Welcome back to another Medvarsity Deep Dive. We're going to be exploring a topic that's both fascinating and complex today, congenital abnormalities.
Yeah, it's a field that really highlights the intricate process of human development. And when we really understand what can go wrong during this process, it really underscores how amazing it is that things usually go right.
Yeah, it's true. We'll be going in depth with a Medvarsity lecture that breaks down how these conditions are classified and what they reveal about what happens before we're even born.
Right from the start, you'll find there are different ways to categorize these congenital abnormalities. And it might seem a little overwhelming at first, but there's a logic to it all.
Okay, so help me unpack this a little. What are some of the main categories we'll be looking at?
Well, we have primary abnormalities, which are also called malformations. And these happen when a structure doesn't develop correctly during organogenesis.
Organogenesis.
Yeah, that critical period from the 3rd to 8th week of pregnancy.
So it's like a blueprint error. The organ itself is constructed incorrectly from the very beginning.
Exactly. Think of conditions like cleft lip or palate or congenital heart defects. These are structural issues that are present right from the start.
That makes sense. But what about cases where the initial formation is fine, but something happens later on to disrupt the process?
That's where secondary abnormalities come in, or disruptions. This is when a normally formed structure gets damaged by some external factor later in fetal development.
Got it. So it's not an issue with the original blueprint, but something that interferes with the construction process as it's happening. What are some common examples of these disruptions?
Oh, there are many. For instance, vascular accidents can significantly impact development. You also have amniotic band disruptions where fibers from the amniotic sac can actually wrap around parts of the developing fetus,
Oh, wow.
leading to deformities. Imagine a thread getting tangled around a developing limb. It paints a pretty clear picture.
That's a powerful image. And it sounds like these external factors could encompass a wide range of things.
Absolutely. We're talking about infectious agents, chemicals, radiation, even physical trauma. There's a whole category called teratogenic agents, things that can disrupt fetal development.
Teratogenic agents, that sounds kind of ominous.
It essentially means causing birth defects, and the range of these agents is vast. On the infectious side, you have rubella, cytomegalovirus, and toxoplasmosis. Then there are chemicals like thalidomide and warfarin, and even some commonly prescribed medications like chloroquine for malaria or lithium, which is used to treat certain mental health conditions.
Wait, so even medications that someone might be taking regularly could pose a risk. That's concerning.
Yeah, it really highlights the importance of having open and honest conversations with healthcare providers about any medications, especially for those who are pregnant or planning to become pregnant. Many of these medications are essential for people's well-being, so it's all about weighing those potential risks and benefits and exploring alternatives when necessary.
It definitely underscores how important it is to communicate with your doctor about any medications during pregnancy. So we've covered primary abnormalities, secondary abnormalities. Are there other major categories we should be aware of?
There are. Deformations, for example, are caused by prolonged mechanical forces on the fetus.
So not damage from an external agent, but consistent pressure that actually deforms the structure over time.
You got it. A classic example is clubfoot or talipes equinovarus.
And then we have dysplasias, right? I've come across that term before.
Yes, dysplasias involve abnormal cell organization within tissues, and they often have a genetic basis. Achondroplasia, a form of dwarfism, and osteogenesis imperfecta, also known as brittle bone disease, are two examples.
And those are conditions that individuals can live with, right?
They are. And that brings up some important ethical considerations, especially when we think about prenatal diagnosis. If a dysplasia is detected, parents are often faced with very difficult decisions.
That's a complex topic. And it's not just limited to those two conditions. There are so many factors that can impact fetal development.
Exactly, and that's why understanding these categories is crucial. It allows us to think critically about the causes of congenital abnormalities and potential points for intervention.
Speaking of complex scenarios, I know there are terms like sequences and syndromes that are often used in discussions about congenital abnormalities. How are those different?
Great question. A sequence is essentially a domino effect, where a single factor sets off a cascade of developmental problems. A good example is Potter sequence.
Okay, Potter sequence. Tell me more.
In Potter sequence, there isn't enough amniotic fluid, often because of kidney problems in the fetus that prevent sufficient urine production.
So a problem with the kidneys leads to a lack of amniotic fluid. What happens then?
Well, amniotic fluid is essential for healthy development. Without enough of it, the fetus can experience compression leading to a range of issues: facial deformities, hip dislocations, underdeveloped lungs. It's a chain reaction.
Wow, it really shows how interconnected everything is during fetal development. And what about syndromes? Where do they fit in?
Syndromes are a bit different. They're groups of anomalies that occur together and have a shared underlying cause, which is often genetic.
So multiple anomalies, but linked to a single root cause.
Mm.
What are some common examples?
Down syndrome, which is caused by an extra copy of chromosome 21, is a prime example.
Right, that's probably the most widely recognized syndrome.
Uh,
But it sounds like there are many others.
oh, there are thousands. Trisomy 18 is another example. The world of syndromes is vast and complex, and each one presents its own set of considerations.
This is definitely a lot to absorb. We've covered primary and secondary abnormalities, disruptions, deformations, dysplasias, sequences, and syndromes. It's like learning a whole new language.
It is a lot, but it's incredibly fascinating. And we've only just scratched the surface. There's so much more to explore in the realm of congenital abnormalities, and each new discovery brings us closer to understanding the intricacies of human development.
It's a powerful reminder of how intricate and delicate this entire process is. And as we learn more about what causes these abnormalities, it opens up new possibilities for prevention, intervention, and ultimately better outcomes.
You might be wondering, why we even bother with all these classifications.
That's a fair point.
Right.
There has to be a reason beyond just, categorizing things for the sake of it, right?
Well, the beauty of the system is that it helps us connect the dots between cause and effect. For example, if we're looking at primary abnormalities, knowing they originate during organogenesis gives us clues about, potential risk factors that might have been present during that specific window of development.
So if we notice a pattern of certain malformations, it could indicate an environmental exposure or a genetic predisposition that was present during that critical time.
Exactly. And then when we look at secondary abnormalities, we can start to recognize patterns of damage that, might have resulted from things that happened later in the pregnancy.
It's like having a developmental history revealed just by observing the types of abnormalities present.
And that's not all. By recognizing these patterns, we can start to develop strategies for prevention. For example, rubella is a teratogenic agent that can lead to serious birth defects. Understanding this link allows us to promote vaccination and protect developing fetuses.
That makes perfect sense. And I imagine it goes beyond just, specific diseases.
Absolutely. It's also about educating people about potential environmental risks during pregnancy, things like avoiding alcohol and certain medications, ensuring proper nutrition, and minimizing exposure to radiation or harmful chemicals.
It all comes back to understanding those crucial periods of development and what can disrupt them.
Right, and when we shift our focus to dysplasias, things become even more interesting because these are often genetically determined. We have to consider a whole new set of ethical questions.
Yeah, you mentioned earlier that some dysplasias are compatible with life, which must lead to some really tough choices for parents.
Absolutely. Imagine receiving a prenatal diagnosis of achondroplasia. While individuals with achondroplasia can lead fulfilling lives, it's understandable that some parents might struggle with the implications.
It's not just about the medical aspects, but also the social context. How do we as a society navigate these complexities?
That's where the conversation becomes really challenging. How do we balance the right to information with the potential for bias? These are difficult questions without easy answers.
So we've talked about prevention in the context of teratogenic agents, and we've touched on the ethical considerations surrounding prenatal diagnosis of genetic conditions. But what about treatment? Are there ways to, correct or manage these abnormalities once they're identified?
That's a key question, and it really depends on the specific abnormality. Some conditions can be surgically corrected either in utero or after birth. Cleft lip and palate, for example, can be repaired surgically. And for certain heart defects, surgery can be life-saving.
But it's not always about finding a cure, right? Sometimes it's about managing symptoms and providing supportive care.
Exactly. Think about osteogenesis imperfecta. While there's no way to completely fix those brittle bones, therapies can help strengthen them and reduce the risk of fractures. Early intervention can often minimize the long-term impact of the abnormality and improve functionality. It's all about tailoring the approach to each individual's needs.
It seems like the field of congenital abnormalities is constantly evolving, with new discoveries and treatment options emerging all the time.
It absolutely is. And that's why understanding the underlying mechanisms is so crucial. The more we learn about what causes these conditions at a molecular level, the better equipped we'll be to develop more targeted therapies.
It's like we're piecing together a complex puzzle one discovery at a time.
And with each piece we uncover, we gain a deeper appreciation for the incredible resilience of the human body and its potential for healing and adaptation.
It's truly inspiring to see how far we've come in our understanding and treatment of these conditions. But I know there's still so much more to learn.
There is. And that's what makes this field so exciting. Every new discovery opens up new avenues for research and innovation, bringing us closer to a future where congenital abnormalities are less of a mystery and more of a manageable challenge.
A future where every individual has the opportunity to reach their full potential.
We're going to wrap up our deep dive into congenital abnormalities today. But this is just the beginning of your exploration.
For our listeners who want to learn more, we'll be providing some resources in the show notes. Yeah, it's amazing to consider all the progress that's been made in such a complex field.
It really speaks to the dedication of the researchers and clinicians and families who have put in so much effort to, really understand congenital abnormalities.
And for families facing these challenges, knowing there's a growing network of support and resources out there must be incredibly reassuring.
Absolutely. There are organizations dedicated to providing information, connecting families with specialists, and advocating for those with congenital abnormalities. It's a true collaborative effort.
And speaking of collaboration, I think it's important to acknowledge the role of patients and families themselves in advancing our understanding.
You're right. Their lived experiences, their willingness to share their stories, and their participation in research has been invaluable. It's a true partnership.
It really highlights the human element of this field. It's not just about cells and genes, but about people's lives.
It's about making sure everyone, regardless of their circumstances, has the chance to thrive.
So we've covered a lot of ground in our deep dive today. We've explored the various categories of congenital abnormalities, delved into the causes and risk factors, and discussed the complexities of prevention, diagnosis, and treatment.
We've also touched on the ethical considerations surrounding prenatal diagnosis and the importance of providing support to individuals and families.
We've talked about how much we've learned, but what about the unknowns? What mysteries are researchers still working to unravel in the field of congenital abnormalities?
That's a great question. There's still so much we don't understand. For instance, we're still uncovering the intricate ways that genes and environmental factors interact to contribute to these conditions. And we're always searching for more effective treatments, especially for abnormalities that have limited options.
It reminds us that science is an ongoing journey, a constant quest for knowledge.
As we continue to explore and question and innovate, we get closer to a future where congenital abnormalities aren't seen as insurmountable obstacles, but as challenges we can overcome together.
A future where everyone has the potential to reach their full potential.
So keep asking questions, keep learning, and keep advocating. The journey of discovery continues.
Well, thanks for joining us on this deep dive into the world of congenital abnormalities. We hope you've gained a deeper understanding of the complexities of human development and the resilience of the human spirit.
And until next time, keep exploring the incredible world around us.